Even in 1,000 papers, if you want to see Mine's paper, I can identify myself. And for a university paper, evaluation for paper, okay? You write it so hard. Fail.
Everyone. Is the screen visible? Am I audible? Thank you all for giving me this opportunity, especially my inspiration, Satyajit Muthukumar sir, who's always been there throughout my undergrad journey. Thank you so much. Uh, the topic that I'm going to be touching base today on is on advanced technologies in dentistry. A small background about me. I'm Dr. Mayak. I did my undergraduation from Chettinad Dental College and Research Institute. The experience that I had that was an experience that everyone should, you guys should be fortunate to be experiencing this thing because most of the colleges will not get such exposure and the vibrant faculty that are there. It is a one of a kind experience. Then I did my master's in prosthodontics from AB Shetty Memorial Institute of Dental Sciences. Following this, I did my advanced certification in oral implantology from Nitya University. I'm currently the owner of Dr. Parek's Dental and Implant Center, and I consult as a prosthodontist and oral implantologist in Chennai. So today we are going to be touching base on these topics. The topic today is an extremely wide and a very complicated topic. I've tried to simplify it as much as possible so that people can get a better idea about what we are trying to get at. So these are the topics under which I'm going to be covering today's session. So to introduce, basically, we've come a long way, right from initially starting to use intraoral scanners to the zirconia crowns currently. These technologies have currently become the part and parcel of dentistry today, and we are using it left, right, and center. Uh, Once any kind of new technology comes, it's always a challenge to accept that technology. But as you begin to use these technologies, you become extremely comfortable, and you understand what are the benefits that you can obtain out of these technologies. So first and foremost, and the most important among all, is the digital impressions. This has completely revolutionized dentistry with state-of-the-art impression making, which is extremely helpful for a lot of medically compromised patients. So this has become the starting point of any kind of digital workflow that we want to enter in dentistry. Digital impressions is the first and foremost thing that we need to look at. So these scanners basically become a vehicle through which we can scan or get details of the procedure or the patient, and then using CAD/CAM technology, construct our processes. So these impressions techniques become the best in patients who are gagging. So when we try to make conventional impression in gagging patients, it is extremely difficult as they tend to, have a gag reflex and vomit sometimes. So these are extremely beneficial. And sometimes when we have cleft cases or we have the large tori where undercuts are present, traditional impressions are extremely difficult. Now, currently there are a lot of impression systems that have come into market. Some of the more prominent ones are as follows, like Serec, Lavas, Itero, Trios, E4D, etc. So now, what are the main parts if we are trying to work on a CAD/CAM system? The first and foremost is that we want to acquire the data of the tooth and the adjacent areas. Once we acquire the data, we have a lot of softwares. These softwares are going to help us design a beautiful restoration, and then through a computerized milling process, we can easily get a good crown or a denture or restorative material out of it. So this is an example on how a non-chromatic scanner works. So non-chromatic scanners are scanners which cannot reproduce the color of the objects, but can give very good detailing. So here you can see a tooth prep of a lower molar has been done. And this is a titanium oxide spray that has been placed in non-chromatic ones. This spray is a must. We place a spray, and then this is how a final image of the arch that is required can be recorded. Now, coming to digital scanners in particular. So what happens is whenever we are trying to do a conventional impression, it becomes very cumbersome and laborious procedure for the patient and the storage point of view. So these digital scanners help us in a very easy manner. We can record the oral cavity, all the content, and store the data as well. So they can either be used in the patient's mouth or in a laboratory setup. So they can either be intraoral scanners or extraoral scanners based on the name and purpose. So now coming to extraoral scanners. So these scanners are used when we were trying to scan a cast of the patient and not the mouth as such. So these scanners either work with the touch principle, where the scanners have to touch the teeth, or optical scanners. Optical scanners can be used to scan images from a slight far off distance. These are more preferred as they do not damage the cast or the structure. So this is a video showing how a non-contact scanner works. So as you can see, a click is made here, and then a part of the image gets recorded onto the screen. In this manner, serially, you keep clicking on buttons or images or buttons on the machine, and then slightly turning your turntable and re-clicking. And if you see, further and further image gets recorded. See, now we are trying to record the anterior part of the same impression. So with these clicks, we can completely record the area of our interest and then finally proceed with the prosthesis. The other is the intraoral scanner. This is by far more commonly used currently in the technological setup of most of the dental practices. The most important thing with these scanners are that they're extremely accurate. They have come to the accuracy for in the tooth processes, probably even slightly superior to the conventional impression making. In implants, in one or two implants, if you're trying to scan them, they are currently at par. But sometimes in multiple implants, they might be slightly inferior or at par. with the conventional impression making process. So this is how a scanned image. So this is how a scanned image of an arch would look like. So here a few teeth have been prepared, and these are some titanium abutments that are used on this implant. The entire thing has been scanned. This is the lower arch, and this is how the patient is at occlusion. So these scanned images are used. These are then transmitted to the lab for them to process the details. So the main benefits of going into digital scanners is that you can immediately evaluate your work. So when you're trying to look at, say, an impression or something, you will get a negative replica, and you will sometimes not be able to appreciate all the details. But in this, you can see all the details to perfection. If any error is there, you can rescan it then and there. It's relatively a more quick procedure. It's very easy to convey the information to a lab which is far off or in a different city or country. This is the most it saves a lot of time and is very easy to send across. And as I told earlier, in gagging patients, it's a complete game changer. And it's very easy to store data in the cloud rather than physical models. So it's extremely crucial that digital impressions are going to become the thing in the future. So this is, as you can see here, a scanning of a lower implant. Here, four implants were placed, and these are four zirconia abutments. A scan of that is being made. So as you can see, as the scanner is being moved, the details of the arch gets recorded here, and this detail, once completely recorded, Sorry for the interruption. I had a power outage. Just a second. Is it visible now? So this is how we scan the lower jaw of one of the patients with zirconia abutments. And then this image was then shared to the laboratory to help us fabricate the prosthesis. Now coming to the more advanced technologies that currently patients are seeking and a lot of clinics are using. One of them is a digital stereogram photogrammetry. So this basically is a technology where a series of photographs are taken at different angulations and at different positions. And these images are then converted to a three-dimensional object, which will help in giving the exact spatial positioning of the implants in place. So the technology is so advanced that the error is only 10 micrometer, which can easily help us obtain the passive fit of the implant framework and the prosthesis. The most important advantage of this technology is that it is very user friendly and is not sensitive to the operator experience. So this is how this technology works like. So this technology can only be used for a full mouth implant case using multiple implant prosthesis. As you can see, this is the camera that is used to click the photographs at various angulations. These are the sensors that sense the image position at the spatial position that the implant are currently positioned at. And this is how you get the three-dimensional spatial positioning of these implants. So the photos are taken approximately at a distance of 20 centimeters from the patient's face or the mouth in particular, and about 64 photographs are taken, which gives the exact three-dimensional position of the implants in the patient's mouth. So this is an extremely advanced and a very good tool, as it can record the implant position quite accurately, and the digital file that is generated out of this can be sent to the lab. So this technology improves the comfort level of the patient, as an impression with an elastomeric impression is no longer required, and it can give the 3D spatial positioning of these implants, which can be sent to the laboratory. So now moving on to the next technology, the 3D printing. 3D printing has come a long way from when it had initially started, where the accuracy was not as great. Right now, with these 3D printed models, the accuracy is quite good in the high 90s, which gives us very good surface details for us to get good processes out of it. So the 3D printing basically is an additive manufacturing where using heat or lasers, layer by layer of the structure of the prosthesis or the cast in question is made, enabling a very good three-dimensional file. This can be used to produce a lot of complicated shapes and different casts and processes of various sizes. So this is how a 3D printing machine works. This is a 3D printer wherein the data is incorporated. Here you can see we are trying to build a cast basically of using the 3D framework. So as you can see, the cast is getting made. And once this is made, it slowly is brought out of the 3D chamber and then 3D printed chamber. And then once all the liquid is drained out and they dry, these are then officially used for purpose of fabrication. Here you're seeing they are getting cleaned. Once they are cleaned and dried, then we can use them in formulating our prosthesis. So the uses currently for 3D printing are to formulate such casts. As you can see here, this is a central incisor that has been prepared, and we can easily use to formulate such casts. This is a 3D printed framework that we tried on in one of my consultation practices at VV Dental Hospital. So what we did was, after we made impressions, we just wanted to see how would the final outcome look like based on what the patient's old denture was. So a 3D framework of that was made, and we used that for uh, doing a trial in the patient's mouth. Based on this, we decided what all adjustment and changes we want to do to get the final outcome. Currently, 3D printing is also used to formulate such resin frameworks for cast partial denture. And this is a patient where we did an overdenture. Now, moving on to a tool that is so important that every dentist must have is an intraoral camera. You don't have to get a very fancy camera. A Walden camera does the job excellently. I will show you why this camera is extremely crucial. See, this was a patient of ours, the first image. A patient of ours came to our practice and was extremely finicky and wanted to know everything that was done in her mouth. So this was how she had presented to us with a decay in the canine. So what we did is we showed her how the cavity looks like. We removed all the decay, used a series detector dye to assess if there is any decay left or not, and then finally did the composite restoration. So when we show the patient a before and after image of what we are trying to achieve, these patients are easily able to grasp what we are trying to get at and become very cooperative with us as they are interested in knowing every small aspect of their life. This is an image that was done by Dr. Aishwarya, again an alumni of Chettinad Dental College. Here, as you can see, we had 5 canals in this patient, and such cases are very important that we document them so that we can use this for our own education. That sometimes an additional canal can also be present, and also the patient understands that we are trying to do good for them, and this is how they are currently presenting us with. This is another case where we have done a core buildup in one of the patients who required a root canal in this patient. Sometimes the patient wants to know what is being done in the mouth. The next image is one of the patient had come to us who had uncontrolled diabetes and had a severe candidal infection and extreme burning sensation. Now it's very difficult to make the patient understand what is going on in the mouth, and hence because of these images we could very easily explain them, and then the compliance of the patient improves. This is another case where we did a canine exposure surgery at our practice. This was done by Dr. Manoj Kumar, another alumni of Chettinad Dental College. So what we did was this patient's parents were extremely concerned as the patient is only 13 years of age and the canine had not come out. So when during the procedure, we could take a lot of photographs, and the parents could also see what we were doing. This gave them a sense of calmness and confidence in both the physician and themselves that whatever is happening to their child is okay. Now, something that is really technologically savvy and is coming up further in in our dental field is the use of such three-dimensional cameras. So what is happening is these cameras are especially in such severe maxillofacial cases where the patient's a huge part of the face is no longer present. These cameras get the entire facial alignment and the facial morphological features of the patient using these cameras at varied angulations. And then a cone beam computer tomography is done additionally. So both of them are overlapped one on each other. And then such images are formed. A 3D printed model is formed, and then a prosthesis out of various silicon materials are made in the patient. And this is how the final outcome can be. So if we are trying to do this case with the conventional approach, it is extremely difficult to obtain a close fit of the prosthesis. And using such technological advancements can give us the best possible outcome and results for the patient. So now moving on to something known as the SAM Axioquick recorder. So this is an example of a three-dimensional mandibular movement recorder. So basically what happens is our lower jaw is very dynamic. It keeps moving. So when we try to regularly record it, we are not able to achieve the exact localization of the position of the jaw. So something like a SAM Axioquick recorder can really help us in gaining the exact morphology and the part of the patient's jaw. So if you see, so it's a three-dimensional face bar record. Now you can see patient does half open, closes, opens completely, again closes, then protrudes his jaw, and does a left lateral movement, and finally a right lateral movement. So these movements help us position and get the exact jaw. Again, see, it's open, close, maximum open and close. Then patient is protruding. You're doing a left lateral movement, and then finally a right lateral movement. So these movements together help us obtain a perfect mandibular movement of this case. And then we know how the patient's jaw moves in three-dimensional planes. So we are trying to rehabilitate a patient of this sort. With using such technologies, the final outcome is a lot better. And hence, these technologies, once you learn or get a hang of it, are extremely crucial to be incorporated into your daily practice. Now, moving on to another thing that was extremely popular, especially in the 2020 and 2021, that is the T-scan. So this is one of the only objective tools where you can assess the patient's occlusion. So whenever you bite or we check the occlusion of the patient using various thickness of articulating paper, it's relatively arbitrary. It's very subjective to what the dentist feels like. But this scan, on the other hand, gives us reliable data numbers. So as you can see here, this is a T-scan of my mouth. So as you can see here, when the patient initially has the first point of contact, there are three areas that touch: 2.5, 2.1, and 1.6. These are only three areas which touch when initially you close your jaw. And when I'm making the maximum closure, as you can see here, there are two spikes noted. One in the 1.6-1.7 region and another in the 2.6-2.7 region. These spikes are the areas where the maximum force of occlusion is present in the patient when they are biting with force. Now moving on to the next important advancement, especially when orthodontics comes into picture, is Invisalign. This is the trend is completely shifting from braces towards aligners, as aligners are a lot more aesthetic. The symptoms are less in the patient, and the final outcomes are very predictable. The most critical among all is the Invisalign. As you can see, this is Dr. Nisha, one of the gum surgeons at our practice, who's currently undergoing Invisalign. So you can see her, this is how the aligners look when she's smiling. They are almost not visible if you are even a meter away. This is the aligners in occlusion, and this is how these aligners are. These aligners, a scan is made, sent to US. These aligners are printed and sent to us by shipment. And then this kind of treatment is done so that the final end outcome is as aesthetic and as we desired initially. Now, something that is currently picking up significantly is the single tooth anesthesia system. So what happens with this is whenever we are trying to numb the lower jaw, we tend to numb the entire one half of the jaw, giving an IA and B nerve block. But what happens with the single tooth anesthetic system is you can anesthetize one single tooth at a time. So the patient's lip, tongue does not get numb, and this enhances the compliance of patient, especially if they are a little scared of dental injections or having their lip and tongue numb. This is a game changer in such a practice. Now moving on to something that is more in the terms of research orientation or something that is currently developing technology. So these are biosensors and nanotechnology. So biosensors is basically a device that is going to incorporate something that is biologically active, which will come in contact with an element or a component in our body or tissue, and then it will help in detecting something. So say we can use a biosensor to detect a particular type of cancer or something like that, where the target that is there becomes the receptor, and then you are going to have a sensor that will sense that and give us a final outcome or output. So how does this work? So the components of this is, first you have an analyte. So analyte is basically anything like a tissue, a fragment of the DNA, or a part of the chromosome. These all can act like an analyte. And then there are receptors. So these are going to have certain receptors which a transducer is going to go and attach to and transmit it to the final measurable signal. So these receptors can be enzymes, antibodies, nucleic acid. All of this can bond or attach to the analyte, and via the transducer give us a final signal or an output. So these oral fluid biosensors can either be salivary based or GCF based. GCF is the fluid that is present below the gingiva. So GCF, the fluid that is translate or inflammatory exudate is collected based on whether the patient, excuse me, has a disease or does not have a periodontal disease. This, excuse me, this solution is collected, and then diagnosis of this solution can easily be done. And here you can detect various biomarkers, which can be using the biosensor technology can help the clinician decide if the patient is at risk, or sometimes can also help in decision making process. So next is the saliva-based biosensors. So a lot of salivary components can originate from the salivary glands, basically. So the saliva is produced by the salivary glands, we know that. So the saliva can be used to detect tumors of the salivary glands, or can be detected, used for detecting various body diseases, as sometimes in a lot of cases, mouth is a representation of what is happening in your body. So these sensors can be used to determine various immunologic, genomics, microbiome of the patient, and then we can associate with a particular disease, or say a particular bacteria is increased in diabetes patients, or in the aggressive forms of periodontitis, something like that. These can easily be analyzed in salivary-based biosensors. So these mainly are currently used for dental caries and periodontitis management, or more commonly in the assessing of um, the patient is at a higher risk of either of the two. So first and foremost is dental caries. So the biosensor that is currently being used is the salivary alpha amylase. So this is a common component in the human saliva, and this binds to the streptococci group of streptococci viridans, basically, which is the main uh, cause of the coronal caries. So the higher the alpha amylase levels, the higher is the color that you get in the final biophotometry when you study. So basically, it's a calorimetric test. So the higher the SAA value, the salivary alpha amylase, higher is the concentrate of Streptococcus bacteria in the patient's mouth. Higher are the odds that the patient is going to have a problem in the future, or is currently facing them. When it comes to periodontitis, these have been used for a pretty long time in detecting various diseases like interleukins, reactive proteins, and matrix metalloproteinases. But currently, the University of Texas has developed a lab-on-chip system. So this basically is a single device where all the components can be easily tested, and through the fluorescence, optical scanner is used, and they can get exact data. So this is a lab-on-chip system that they have developed at University of Texas, which is currently being tried out in the US. So now moving on to nanotechnology. Nanotechnology is something that is becoming extremely popular in today's uh, the age of dentistry, especially right from our composites to just name a thing, even bone grafting. Nanotechnology is becoming a very pivotal um, component, as these smaller nanoparticles can easily go and uh, uh, enhance the final outcome of the patient. So these components that are used in nanotechnology have a size varying from 0 to 100 nanometers, and these are used in various sizes based on the particular mode of usage. So nanotechnology's main role currently is in nanocomposites, in certain moldable ceramics, in some impression materials that are currently in the market. They also are helping get a better bone growth in patients who don't have bone, and they are playing a role in dental implants. So if we are looking at nanocomposites, so what is happening is these the resin component that is currently present is not majorly modified, but the filler particle is what is getting modified in these nanocomposites in most of the cases. So these nano filler particles that are being used in current composites are basically aluminum silicate powder. So these powders are going to be mixed with silica so that the strength of the composites gets enhanced. Additionally, the polishability, because of the nano components, is also enhanced, so the final end outcome is a lot more aesthetic. So the main advantage of using these composites are that the strength is better. They have a good hardness. Translucency, it's very important that the composites are translucent so that in front teeth we can get beautiful aesthetic results. and then they are extremely polishable, so you can obtain a high polish. So now you have something called as the nano optimized moldable composites or the ceramics. I'm sorry. So these ceramics, basically what is happening is in composites, these ceramics, which are nanoparticles, are being incorporated so that the end outcome is more durable. So the strength basically increases significantly. So when you use these as fillers, the wear is reduced and the polishing ability is enhanced. You can use them as pigments. So when you're trying to match the color of the adjacent teeth, these nanopigments can glow into these smaller areas and help you in a better shade match. And some nano modifiers can also be used, which help to enhance the stability of these materials and also prevent sticking of the component to the instrument. This is a very important problem. This is a common problem that clinicians face where the composites keep sticking onto the instruments. This once the nano modifiers are added, the odds are reduced significantly. So this is how the current market, the 3M ESP composites that are in the market are majorly nano composite based material, where multiple nano components of the matrix are used, and then you get a final composite which has extremely high polishability and are very durable. Dentsply Sirona also has come up with their nano ceramic composite. This is Ceram X Ferrect. So this is extremely aesthetic ceramic and can very easily blend with and give you a very aesthetic final outcome. So in impression materials, so the most commonly used impression material in current crown and bridge is the polyvinyl siloxane or the previous impression material. So this material is going to record the surface details to the teeth. They are extremely accurate with the accuracy ranging above 99%, and the final outcome is extremely good. The main problem we face with this is there is moisture contamination. So whenever there's even slightest moisture, what happens is the surface details are not recorded as well. So what the companies have done is they have incorporated nanotechnology, which makes the surface tension significantly less. And now this is moving towards more hydrophilic impression material, and hence a minute amount of contamination still gets us excellent outcomes and results. So currently the Elite HD of Zermac, HD Plus, and the Imprenta 2 Penta from 3M ESP, both are addition silicone impression materials. They are in the market, which are hydrophilic because nanotechnology has been used in their formulation, and the surface recording details is highly accurate. So next, moving on to bone growth. So a lot of times what happens is we end up with a patient who does not have adequate bone. We have to grasp and do a guided bone regeneration, or we have to preserve the socket. In such cases, we require a material that will help us with the bone growth in these patients. So what we do, what the technological advancement here is, they have used hydroxyapatite and they have broken down the particles to nano-sized particles. So these can easily go and accumulate in the microstructure, and they become so a very highly porous component is no longer present. Instead, these nanoparticles accumulate on each other. As you can see, once again. So these particles will accumulate on each other and then give us a final outcome where the porosities of gaps are extremely less and end outcome is quite good. So the currently in the market, we have the Ostim graft that is using this technology. So this technology basically, the one they are using is a nanobioactive glass in addition to the hydroxyapatite crystals that are present, so that the final end outcome is quite good. So now moving on to dental implants. Dental implants, as you know, is becoming the next big thing in dentistry in India now. In abroad, dental implants has been long the main mode of treatment, especially for replacement of our missing teeth. But it's significantly picked up in India as well. So the use of nanotechnology here is mainly in hydroxyapatite coatings. So a lot of implants are surface coated with these hydroxyapatite crystals, so that they enhance the adhesion of the implant to the bone by the means of adhesion, proliferation, and finally enhancing the mineralization around the dental implants. So as you can see here, when a conventional hydroxyapatite crystals are used, only few particles can be coated onto an implant. This is a representation. And here, if you see a nano particle of the same, if you are using, excuse me, a lot more particles can very easily accumulate in that region, and this can enhance the final osseointegration in these implants. Now, let's see a couple of case scenarios on how we are incorporating these technologies in our day-to-day practice. So, this is a patient who presented to us with um, root canal treated anterior three teeth. The patient was extremely unhappy with the way the teeth were looking currently. So the root canal was already done at a different practice. So we initially did a shade match, made the patient did an aesthetic trial to see how it would look like. We did a tooth preparation, did a gingival retraction, and then scanned the images of the patient. As you can see, this is how the final scans look like. These are the scans of the patient in various angulations. And then once we get these scans, we uh, design these crowns in in the software. As you can see here, individually these three crowns were designs. These marks that you can see, red, green, blue, these are the marks of contact that are present. Red indicates a very heavy contact, where the lighter the blue is, it indicates that the contact is minimal or mild contact is currently present. So this is how you get the designing done, check for occlusion in the software. And this is how the milling is done. This is a 4-axis milling system where you can see one of the anterior crown is being milled. The anterior crown were made using lithium disilicate or Emax. So this is how the milling machine moves around, and then finally you get the exact crown that you have designed. And then this is how the prosthesis looks in the patient's mouth. And this is how the patient's smile looks like finally. This is how we started with, and this is how the final end outcome of the patient looks like. Now, moving on to a case of central incisor. As we know, it's very difficult to do a shade matching of a central incisor. So what this was done with a complete digital approach, where we did a tooth prep, then a 3D printed model or the framework was made over, and then simultaneously a designing of the model was made in the laboratory, and this is how the final outcome looks like. Because of using digital technology, the precision is extremely high. So this is the scanned image of the patient. So the patient had a large decay on the lingual aspect, and a root canal had to be done. Since more than 2 walls were involved, we had decided to go ahead with the crown as well. This is a scan of the tooth after retraction of the tooth was also done. This is how the entire arch was scanned. You can as you can see the benefit, you can move the entire the scan around, see in every angulation, see if anything has been left out. As you can see here, there was a small white area which was not scanned correctly. So following this, we again scan that area. If such errors are there in a conventional impression, it's very difficult for us to be able to record this properly, and hence, since we had a scanning, we could immediately scan it and record the details. So this is another case of an anterior smile design where we did canine to canine crowns in this patient. This is how the 3D designing of the crowns look like. This is from the frontal view, and this is, you can see the overjet in these patients. This was a patient who had a class 3 bite. So the final outcome was somewhere in between edge to edge or just a class 1 bite in some of the teeth. And the patient is currently undergoing Invisalign after this to correct her cross bite. So now scanning is just not restricted to fixed prosthesis. Even in removable prosthesis like cast partial dentures, 3D printing is becoming the gold standard. So as you can see, this is a patient with missing bilateral posterior teeth. So a scan of the cast was made. This is how a virtually designed cast partial denture looks like. This is the tentative metal framework that would be the final outcome. It's just built on the computer. Then a 3D printed resin model is made out of this of the resin material, once the additional extensions are cut, this is how the framework fits. You can see the intimate and excellent fit that you can get out of it. And this is the final outcome that is in the patient's mouth. Some additional cases that we've done. This is the case of these photos have been given to me by Dr. Achyut Chenawar from Pune. So he has recently done a precision attachment case where he wanted to use friction fit cast partial denture onto the framework. So what he did was he's prepped these teeth, given a precision attachment here. This precision has also been made using a complete digital framework so that the accuracy is excellent. These are some other cases that that the same clinic has done using cast partial dentures, and this is how the three-dimensional framework looks on the cast. Now, to conclude this advances in technologies, these technologies are extremely rapidly advancing in dentistry. It is extremely crucial that we, as dentists, try to encourage ourselves to accept these technologies so that we are abreast with the current norms and are at international standards. The most important thing with the technology is that you adapt and you learn. Whenever there's a new technology, you try to learn and adapt yourself so that the final outcome that you're able to give to your patients is the best that anyone can give. Thank you so much. Thank you for this opportunity. I'd like to thank Dr. Bhuvaneshwari for coordinating and helping me with the presentation, and ever grateful to Dr. Satish Muthukumar sir, who's been a pillar of support always. Thank you so much for the opportunity.
Thank you, Mayank. It was an excellent presentation.
Thank you so much, ma'am.
As a token of appreciation, we are presenting Dr. Mayank this guest lecture certificate.
Thank you so much. Thank you, ma'am.
Any participants, does you have any questions? Thank you, Dr. Mayank, for your time. It was an excellent session that you talked all about the detector dye and newer impression materials with the nanocrystal particles, which prevents the anti-caries, prevents the caries, and 3D making of cast partial denture. Thank you, Mayank.
Thank you so much. Thank you.